He is MD in psychiatry and working as consultant psychiatrist at Mind Wellness Center at Lucknow. And he's going to deliver his lecture on depression, depression management and prevention. Depression एक बहुत बड़ी प्रॉब्लम, डे बाय डे इट्स बिकमिंग अ वेरी बिग प्रॉब्लम फॉर द पॉपुलेशन इन जनरल. अगर हम लोग सिर्फ स्टैटिस्टिक्स की बात करें, I mean, जो रिकॉर्डेड केसेस हैं, अगर हम सिर्फ उन रिकॉर्डेड केसेस की बात करें तो WHO का ये कहना है कि 5 to 6% पॉपुलेशन आज की डेट में डिप्रेशन से ग्रसित है. 5 to 6% को जब हम नंबर्स में बदलते हैं तो इट्स अराउंड 300 मिलियन पीपल. इट्स अ ह्यूज नंबर. एंड एज फार एज इंडिया इज कंसर्न्ड, यहाँ पे भी डिप्रेशन के केसेस में स्पेशली आफ्टर कोरोना बहुत तेजी से इंक्रीज हुआ है. और फिर से मैं स्टैटिस्टिक्स की बात करूं तो स्टैटिस्टिक्स भी ये बताती है कि 1 in every 20 इंडियन आर गोइंग थ्रू डिप्रेसिव फेजेस. अपनी लाइफ में एक बार जरूर वो डिप्रेशन से गुजरते हैं, ट्रीटमेंट की जरूरत पड़े या ना पड़े. और डिप्रेशन का जो एक सबसे बड़ी दिक्कत होती है वो है सुसाइड. अभी मैं देख रही थी स्टैटिस्टिक्स की मैं बात करूं तो अभी मैं देख रही थी कि हर साल लगभग 8 लाख लोग पूरी दुनिया में डिप्रेशन की वजह से सुसाइड करते हैं. और इसमें सबसे ज्यादा संख्या टीनेजर्स और अर्ली अडल्टहुड की है. 18 to 29 ईयर्स के लोग सबसे ज्यादा सुसाइड करते हैं. और मेजर कॉज क्या है? डिप्रेशन. और डेथ की भी अगर हम बात करें तो डेथ में सुसाइड चौथे नंबर पर कॉज के रूप में आता है. और पीछे से कॉज क्या? डिप्रेशन. और पोस्ट कोरोना पूरी पिक्चर बदल दी है पूरी दुनिया की. तो मुझे लगता है आज की डेट में बहुत जरूरी है कि हम डिप्रेशन के बारे में बात करें. हम बात भी नहीं करते हैं क्योंकि हमको लगता है कि यार ये तो बहुत छोटी सी प्रॉब्लम है, पर स्टैटिस्टिक्स में जाए तो लगता है कि नहीं, इट्स नॉट अ स्मॉल प्रॉब्लम, इट्स अ वेरी बिग इशू एंड इट्स अ हाई टाइम वी शुड टॉक अबाउट इट. सो शाश्वत सर, आपका बहुत स्वागत है इस मंच पर. इतने इंपॉर्टेंट टॉपिक के साथ आप आज हमारे बीच हैं. मैं चाहूंगी आप सीधे आपको मंच देना, आप अपनी बात शुरू करें.
A very good evening, everyone. It's all my pleasure to be invited to give lecture on this platform. I'm sharing my slides, and I will prefer all these sessions be interactive. I'll be asking, talking, so that we all learn together. Is that fine with everyone?
Yes, sir, of course. I think everyone will be comfortable.
Sure. So here we start. Are my slides visible?
Yes, sir. It's visible.
Okay, thank you. So as I start, let's have a view of this picture. You see a guy sitting at the corner of a room in the dark. What do you think? What are his emotions? What is he thinking? What about his sleep or appetite or energy? Or what about his behavior?
Dr. Saxena, please give it a full slow. Full slow should be.
Slide show, please, sir.
Slide slow. Slide show should be full.
Yeah,
Is
okay.
Yeah,
Now, okay.
That's good. That's good.
So what one can think about the emotions of this guy?
My life is hopeless, worthless, and meaningless.
Sure, these are his thoughts. Probably he could be his thoughts. His emotion appears to be, he appears to be sad. And what about his level of energy, sleep, or appetite? Anything when you can comment on it? Surely we can't comment on his sleep and appetite, but his energy appears to be low. He's looking down. Any other thing which is there in the behavior? Seema ji, you would like to add anything?
He is inactive, sir.
Ji?
He is inactive.
Yeah, sir. He is inactive, his energy is low. Anything else?
Sir, helplessness.
No, that might be his thought. He might be thinking he is helpless. In his behavior, anything? He appears to be lonely. He's sitting alone at some corner, light is less. So what do you think he's suffering from?
Hello.
Hello? Yeah.
Persistent feeling of sadness and loss of interest.
Sir, looking at the picture, how can we comment it is persistent? Picture actually says only that he is sitting low, he is probably crying, he is thinking something negative, his energy appears to be low, he is lonely. That's what we can comment on the picture. Agreed? Sure. So here we start, and this is how many of us we have landed in this situation?
Once in
Almost
our life,
every,
suppose everyone.
almost every one of us once. Yeah. Thanks, Suvasni, for raising the hand.
Thank you.
Actually, this is low mood. And if there is a good movie, a good friend, family member comes around to you, your motivation is lifted, you are giving some good hope, someone talks to you, you have some good music, you can be sitting around with a popcorn, watching the movie, and your mood would be better. So what this picture referred was a type of emotion which was low, a type of thinking in which one was thinking about the past, guilt, maybe I did something wrong, or about the future, if there is something not going well in the future too. His energy appears to be low, his behavior appears to be lonely, and it can be changed. And all of us have landed in this situation. Depression, what we are talking about, is something like this. If it persists for more than 2 weeks, leading to impairment in professional, social, or personal life, then we'll call it depression. So it is not the picture or the basic thing which was reflective of clinical depression. It was these three things: continuous for more than 2 weeks and the impairment. So there are a number of things which may come up when one is suffering from depression. The most common thing is the mood we talk about. He would be having low mood. He could be anxious and he could be irritable, because अगर हम लोग उस बच्चे को छेड़ने की कोशिश करें ना, which we in the background picture, he might get irritated.
Recording in progress.
Why you are poking me? So it could be low mood as well as चिड़चिड़ाहट, irritation. Why you are trying to irritate me? I don't wish to speak to anyone. So this is irritability. Along with anxiety. The thought process is generally negative, and negative in three senses. In the past, one would be having abnormal guilt. I have done something wrong in the past, and that's why I am suffering now. Second is regarding future. It is not, I don't see any future, or probably I'll be thrown out of my job, or I won't be able to take care of my family. Negative ख्याल future के लिए. And the confidence for the current negative thought is confidence. Supposedly, let me give you one example. So just today, I had a patient and he was around 60. उनका कहना था his mother died because of him. मेरी वजह से मेरी माँ का देहांत हो गया. How? Well, I wasn't able to take her to hospital when she had cardiac attack. At the dim of night, around 3 she had collapsed and I couldn't know. He himself was around 60. पर उनमें इतना गिल्ट था कि मेरी वजह से मेरी माँ का देहांत हो गया. रात के 3 बजे वो ले नहीं जा पाए. This is abnormal guilt. Hey, it's fine. But this is abnormal. रात के 3 बजे किसी को हार्ट अटैक आ गया तो one is unable, ध्यान पता नहीं चलता है. But he was having this pain in his mind that I was responsible for the death of my mother and that was leading him to cry. So this is abnormal guilt. When we talk about pessimism, there are 3 levels of it. Bleak view future की उतना अच्छा तो नहीं होगा, शायद हम उतना अच्छा नहीं कर पाएंगे. From this level to the level, अब कुछ बचा नहीं है. And no one can help me out from this situation. So this is hopelessness. In between there comes pessimism. And pessimism says, I may lose my job, I may not pass, I will fail. This is pessimistic view. भाई तुमने एग्जाम तो दिया नहीं है, फेल के बारे में तो नहीं फेल हो जाएंगे. So this is pessimism. And many a times people say, okay, we'll put an effort and probably you will be able to clear and something will cheer up. No. If that is the level, no, I won't, there is no way out of this situation, then it is hopelessness. I'm hopeless. There is no way out. And that is very important because it is a separate important criteria to assess suicidality in any patient. Anyone who is hopeless, that this condition is unlikely to improve. I'm going to have a bad future and nothing can help me out. This guy is likely to be suicidal. So these are mood and thought related symptoms, and from here to the biological symptoms. Poor sleep, when I say poor sleep might be longer or shorter, but in most of the patients, sleep is less. In patients of depression, disturbed appetite, most of the time it is that the person is having low appetite, patient has started avoiding meals, along with poor concentration and fatigue. And easy to understand. These biological symptoms, they can be result of this thought process. Because of that background, subconscious negative thoughts, one is unable to concentrate on the current situation, leading to poor concentration. Or it could be alternatively too. And finally, because of these mood, thought, and biological symptoms, there are behavioral changes that the person has decreased interest in previously pleasurable activities. Like if I'm interested in speaking, giving lecture, I lose the interest. Or I like watching movies, I like playing badminton, I cut it down. I don't feel like, just like the guy in the background, he doesn't feel like going out. Withdrawal, and at times use of substances or suicide attempt. So these all are the symptoms of depression. It is not moving. So ICD-10 gave some criteria to diagnose depression. there are three criteria. Low mood, that is persistent low mood, लगातार रोते रहने की इच्छा, छोटी छोटी बातों पे रोना आना, उन चीजों पे भी रोना आना जिन पे रोना नहीं आता। सपोजेडली आज तक तो टीचर ने पूछते थे, घबराहट नहीं होती थी, अब आज आना पूछ भी लेते हैं ना तो रोना आने लग जाता है। So persistent low mood, decreased interest in previously pleasurable activities, and fatigue, decreased energy. These are the three major symptoms of depression, out of which one requires only two as major criteria. And along with that, there are 7 minor criteria, out of which one requires only 2 to diagnose as depression. So 2 out of 3, low mood, decreased interest, or fatigue. And among the minor criteria, that is the thought related criteria, pessimism, worthlessness, abnormal guilt. Worthlessness is related to poor confidence. नहीं, अब आज मुझसे नहीं होगा, जो गाड़ी चला लेते थे अब नहीं चला पाऊंगा मैं, मुझे नहीं लगता अब मैं गाड़ी चला पाऊंगा, बैंक का काम कर पाऊंगा. This is decreased confidence, या मुझसे अब कुछ भी होगा, that is worthlessness. So thought related criteria, biological criteria related to poor sleep, appetite, suicidal ideations, and poor concentration, they make up the minor criteria. And easiest way to remember depression is 2 plus 2 plus 2. Any 2 major criteria, any 2 minor criteria for 2 weeks, 2 plus 2 plus 2 is equal to depression. So here we move to why depression happens, why someone suffers from depression. Again, I repeat, one needs only 2 major criteria, 2 minor criteria for 2 weeks to be diagnosed as depression. So in general, our brain has some neurotransmitters to manage our emotions. Now, these neurotransmitters, they are formed by our diet and they act in specific brain areas and they make us feel happy. Even if I say, I give compliment to anyone, you are looking great. Even if I just say, Sir Ramjilal, sir, you did great, thank you. And the smile on his face has come because of these neurotransmitters being released in the frontal lobe. So these neurotransmitters, which are norepinephrine, serotonin, and dopamine, which are formed by dietary components, they reach the brain and they get attached to the work in the brain areas by neurotransmitters, by receptors. So why depression happens? There are 4 reasons. One is if there is high stress. When there is stress is high, it acts 2 ways. It is actually a balance. अगर स्ट्रेस लगातार ज्यादा रहेगा तो न्यूरोट्रांसमीटर कम पड़ने लग जाएंगे. The balance will be shifted towards low mood. The other way around is when we are stressed. Supposedly किसी की marital life में भी लड़ाई झगड़ा बहुत चल रहा है, प्रोफेशनल लाइफ में बहुत ज्यादा स्ट्रेस चल रही है, it releases the same cortisol which is released in COVID. High. It is required to manage stress. जब बढ़ने लग जाता है, when cortisol is high, it leads to inflammatory markers. Inflammation होता है, IL-6, C-reactive protein, and that lowers neurotransmitters. One of the most common reasons why one suffers from depression is regularly high stress. That leads to release of neurotransmitters and high cortisol, resulting in lowering of neurotransmitters. Another reason could be dietary changes, vitamin D deficiency, vitamin B12 deficiency. They all can lead to decrease in neurotransmitters, resulting in depression. And finally, there can be damage to the brain tissue that occurs because of a stroke, dementia, head injury, because of which the neurotransmitters, they can't act on the particular area, resulting in depression. And since these neurotransmitters, they act on the brain area through receptors or transporters which are genetically determined, genetics plays a very important role, because if the receptors, they are poor, these neurotransmitters, they won't be able to act in the brain areas. So 4 basic reasons. One is stress, the most common. Stress is high, there is high inflammation, high cortisol, the person is depressed. Another is dietary deficiencies resulting in low neurotransmitter formation, resulting in depression. Third is poor genetic composition, poor receptors, resulting in depression. Or fourth, the brain damage. And that is why with dementia, with age, depression is high. Those children who are suffering from brain damage or stroke, the chances of depression, they are extremely high. So why we should be concerned? We should be concerned because 6 crore people in India, they suffer from depression. That is according to National Mental Health Survey 2016. And then this spiky thing came in 2019. And last study in 2020 revealed that 40% people in India had depression or anxiety symptoms. So the number of patients, they are extremely, extremely high. These are symptoms. If we take up the disorder, it would be low. What the criteria we discussed, that was disorder, but the symptoms, they were present in 40% of Indian population. That was extremely high. So how it is treated? 3 options: medication, psychotherapy, or both. And if anyone says which is the best way, it is the both. Both should be offered. So when it is good to start with, but most of the time people, they are not using both. They are actually either in the medication, some people they are in psychotherapy, some people consider counseling, but I will discuss counseling is not a solution. And finally the both. Starting with antidepressants, these are the range of antidepressants with us. SSRI, that is selective serotonin reuptake inhibitor. The serotonin is the neurotransmitter which makes us feel calm, relaxed. Norepinephrine is the neurotransmitter which makes us feel energetic. And dopamine is the neurotransmitter which gives us pleasure. So these are specific acting medications, acting specifically on particular neurotransmitters and increasing them in the brain. Most commonly, SSRIs, they are used: escitalopram, sertraline, fluoxetine, and paroxetine. Serotonin, norepinephrine reuptake inhibitors act on serotonin and norepinephrine, duloxetine, and desvenlafaxine. Mirtazapine actually acts, depending on the dose, on all 3 too. Amitriptyline and nortriptyline, they act on all 3. There are 3 beneficial in treatment of depression. These are cognitive behavior therapy, interpersonal therapy, and behavior therapy. So when to use which one? I told at the start itself, the best is to offer both pharmacotherapy and psychotherapy. Pharmacotherapy is, if one is likely to choose only, it is preferred in severe depression. In depression with psychosis, it is preferable that the person uses pharmacotherapy. There is no other chance. Or ECT. But when it comes to mild to moderate depression, both psychotherapy and pharmacotherapy, they are equal. And then it depends on different criteria like affordability. Psychotherapy is actually a bit costlier, particularly in India. Biological symptoms like poor sleep, poor appetite, poor concentration warrant preferable use of pharmacotherapy. The most important reason a pharmacotherapy should be offered to someone in mild to moderate depression is commitment. Psychotherapy actually requires a lot of commitment. It's a very good thing, but the commitment required is higher. 1 session per week by the patient, as well as commitment to do whatever has been taught in the therapy session, at least half an hour to 1 hour daily at home. And one another thing is early response. Medications, they start having their effect by 10 days, 14 days, whereas first 2 or 3 sessions, they are actually introductory sessions in all the therapies. Now, the benefits of the psychotherapy, and they are not preferred in depression with psychosis, they are not offered. Till psychosis is there, no psychotherapy has any benefit. They are preferred in bipolar depression. They are preferred in adolescent and geriatric depression. In pregnancy and lactation psychotherapies, they are preferred over medications. And by all means, they are comparatively much more safer than medications. Now the problems they are same: accessibility, affordability, and commitment. Psychotherapies, they are less accessible because trained psychologists in therapies, they are few. Affordability is again an issue because sessions, they are costlier. And finally, the most important thing remains commitment, because a person undergoing psychotherapy has to commit. At least from his side, he will visit regularly, he will do things regularly. Without that, कोई ज्ञान की मुद्रा से ज्ञान दे देने से डिप्रेशन सेटल नहीं हो रहा होता. So best is this, along with lifestyle changes. And these lifestyle changes, they are sleep hygiene, exposure to sunlight, and exercises. Yoga and exercise, they have add-on multiple benefits in depression. And in 2-3 months, the person would be back like this as he was. So if we have to sum up depression, it is 2, that is 2 major criteria, 2 minor criteria, that is 2 plus 2, 2 weeks required. Again a 2 plus 2 plus 2, and 2 to 3 months of treatment. Treatment could be pharmacotherapy or psychotherapy. And result would be 2 plus 2 plus 2 plus 2. Patient would be back, sitting on the sofa, taking popcorns, listening music. And this treatment has to be continued for a minimum period of 6 months. Again, there is an issue. People take up treatment and they stop. That should not be the case. The first episode, depression patients must take treatment for a minimum period of 6 months. After their treatment symptoms, they improve. Whether it improves by pharmacotherapy or psychotherapy is immaterial, because even in psychotherapy, sessions chalte rehte hain. Maintenance sessions, they have to be taken, and person has to take the maintenance sessions during the maintenance period. And if the person is having second or further episodes, it takes some 3 months time for improvement, and treatment has to be continued afterwards for a minimum period of 2 years. So 2 is very important in depression. So what is the role of counseling? Role of counseling is important because of stressors. The difference between psychotherapy and counseling remains: psychotherapies, they are structured. Everything is given in a session. It is pre-planned, which is offered to the patient, and patient has to follow as homework. Whereas in counseling, we resolve the stressor of day-to-day life. Let it be marital, academic, related to career, so that depression doesn't develop, and counseling is important so that relapses, they don't happen. But if one has to improve in clinical depression, he should be offered a proper psychotherapy for a period of 8 to 9 months. Session duration can be increased during maintenance period. To prevent depression, we need to focus on 3 things. One is, there was a research why we are getting depressed as a society. इतने क्यों बढ़ गए? And they found out 3 reasons. One is, we are actually animals which are expected to move around for a minimum period of 6 to 8 hours. Now we have turned into ornamental plants, sitting in our cabins, rooms, away from sunlight. And they pointed out the major reason is we are not exercising. One. So to prevent depression, we must be pushing people to exercise daily. It could be any aerobics, yoga, walking, cycling. Second important thing which they pointed out was we are actually sunlight deprived. No other animal in this world or plant in this world can survive without sunlight. We are actually sitting in our concrete jungles without sunlight exposure. And if we go out in sunlight, we put sunscreen. So we are actually sunlight deprived. And one of the therapies for depression is light therapy, exposure to light. And the third thing is, we are not expressing. We are actually social animals. We are getting less and less and less social now. So we're not having their natural intention how we used to be. We are actually a typical ornamental plant now. And that's why we are getting depressed. If we can't express ourselves, we are likely to get depressed. So one can express by way of having friends. Friends नहीं मिलते, one can go for writing a diary. वो भी available नहीं है, one can go for hobbies. They all make you express. Painting, singing, playing guitar to playing badminton. That makes you express yourself. To prevent depression, we need to focus on 3 things: exercise, express oneself, and get some sunlight. Thank you. That ends my session.
Now session is open for discussion, please. Hello, Dr. Saxena.
Yes.
Yes, sir.
क्या हम ये मान के चले कि डिप्रेशन के कारण ही सुसाइड की घटनाएं हो रही हैं, और क्या कोई ऐसा सिग्नल है जिससे सुसाइड को प्रिवेंट किया जा सके?
Yes, sir, sure. For the first part, depression is not the only reason of suicide. Depression is one of the reasons of suicide. The other important reason is impulsivity. And most of the time, depression is like, in depressed patient, they actually call for help. they don't want to kill themselves. Impulsive people, they are like, okay, I will jump. If this doesn't happen, it hurts me, I'm going to jump. And substance use actually affects our decision making, so it is another third important cause, because it makes one more impulsive. So other than depression, I would say these two other important things they should be counted. Others are other reasons, but impulsivity and substance use in the person actually increases the chances of depression, suicide too. Now, as far as preventing depression, suicide is concerned, by way of assessment, so we can assess the most important thing remains the previous episode. If the person has attempted previously, it is high likelihood that the person would commit another attempt, and this could be far dangerous. Another would be family history of suicide. If patient has some sort of family history of suicide, some example that this is a way out to solve a problem, they will start committing suicide. Third is depression, impulsivity, news like a type of thoughts which are coming in the mind of the person, hopelessness, that there is no way out. If the person is thinking like that, this is one of the criteria to decide the risk of suicidality in the person. Use of any substance, alcohol, cannabis, smack, all these.
Dr. Saxena, just we found one example that Deepika Padukone was also in the state of depression, and Sushant Rajput committed suicide.
Yeah.
So can we say that the celebrities are also suffering in the same way as a common man or a layman is suffering? Is it so?
Sure, sir. Illness knows no one's status. Leave apart this means illness. Actually, just like COVID, we number of people died. They also feel lonely, and at the end of the day, they also get depressed. So it is for same. There are number of people from IAS to politicians, high level posts, they have committed suicide. Depression has been there with them. So it is common for everyone.
सर क्या मैं क्वेश्चन पूछ
हाँ बिल्कुल पूछिए मैम, बताइए।
सर जैसे can I ask first, ma'am?
Yes, of course.
Thank you so much. Thank you so much. Yes, okay. सर जैसे हम स्कूल काउंसलर्स हैं, तो हमारे पास उतना टाइम नहीं होता, और कई बार जो पेरेंट्स हैं वो बाहर जाके थेरेपीज लेना या वो प्रेफर नहीं करते, क्योंकि इस चीज की सीरियसनेस को वो समझते नहीं है। तो ऐसे में आप क्या सजेस्ट करेंगे? जैसे मेरे पास 5th क्लास में भी एक बच्चा है जो कि कुछ उसके जो पेरेंट ने बताया उसका भी कुछ सिम्टम्स इसी टाइप के लग रहे हैं। एक 6th क्लास में बच्चा है, मैं गर्ल्स की बात कर रही हूँ, और एक 9th क्लास में लड़की है। मतलब ये बहुत छोटे बच्चों में भी देखने को मिल रहा है। तो मैं ये पूछना चाह रही थी कि जैसे हम काउंसलर्स हैं, अगर पेरेंट्स बाहर नहीं लेके जाना चाहते थेरेपीज के लिए, तो हम किस तरीके से उस चीजों को हैंडल कर सकते हैं?
मैम इन जनरली अगर उल्टे तरीके से उनको डायरेक्टली बताएंगे डिप्रेशन, दे विल नॉट टेक इट। बट इफ वी टेक इट लाइक इसको खेलने की जरूरत है और इसको 2 घंटे जरूर खिलाएं, he should be playing daily. He needs depression in particularly in children still has a big taboo. किसी फैमिली मेंबर को बताओ तो बुरा मान जाता है।
यस सर, यस।
और ट्रीटमेंट के हिसाब से बताओ तो बिल्कुल ही नहीं मानता कि अब कौन सी ऐसी बातें तो कुछ नहीं है। बट इफ वी से कि हाँ इसको जस्ट लाइक द ओल्ड सेइंग गोज कि इसको मिनिमम 1-2 घंटे खेलने की जरूरत है, इट हैज गॉट गुड इफेक्ट। सेकंड इज इसको रोज जो है इसे किसी हॉबी में इन्वॉल्व कर दीजिए। बच्चा एक्सप्रेस नहीं कर पा रहा होगा। Now children, they are more lonely because families they have shrunk. एंड दे आर न्यूक्लियर फैमिली, सिंगल चाइल्ड, तो बच्चा एक्सप्रेस नहीं कर पाता है तो बहुत परेशान रहता है. So in that case, hobbies or any sort of mix up with fellows that helps कि वो रिलैक्स होने लग जाए, अपनी बात कह लेगा तो रिलैक्स होने लग जाएगा. बच्चों में जल्दी इंप्रूव भी हो जाता है, मतलब नॉट जस्ट हो रहा है, ये इंप्रूव भी जल्दी होता है. तो अगर उनके केस में तो काउंसलिंग भी, क्योंकि मैनी टाइम्स इनमें सिम्टम आते हैं और जल्दी वो वॉश आउट भी जल्दी हो जाते हैं कि आप जो है खेलिए, बात करिए, इवन आप काउंसलिंग भी करेंगी मैम तो उनमें जल्दी रिस्पॉन्स आएगा. तो अपनी बात बता लेंगे, परेशान चल रहे होंगे, चल जाएगा, उनको आप पेरेंट्स को गाइड कर पाएंगे. एंड देन वी कैन ओनली डू आवर ड्यूटी. आप इनके फैमिली मेंबर्स को अगर लगता है क्राइटेरिया फुलफिल हो रहे हैं तो आप बता दें, और इफ दे टेक इट सीरियसली इट्स इज गुड, नहीं तो यू कैन जस्ट कीप ऑन टेलिंग देम, डोंट हैव दैट मच गिल्ट. वो जब रिस्पांस उनका पढ़ने में कम होता है तो अपने आप ही पूछने आ जाते हैं अब क्या करें, तो तब बता दीजिए कि भैया अब दिखा लो जाके.
सर एक तो बच्ची है जो 6 में मैंने बात करी, वो तो जब उसको एंजाइटी ज्यादा होने लगती है तो अपने जो सर के बाल हैं वो निकालना शुरू कर देती है.
हाँ,
वो इतने बाल अपने निकाल चुकी है अपने सर के कि उसके मदर ने फिर उसके हेयर कट ही करा रखे, बिल्कुल है ही नहीं उसके
मैम.
सर के बाल.
ट्राइकोटिलोमेनिया है, ये एक साइकेट्रिक कंडीशन है, बच्चों में होती है, इसे ट्राइकोटिलोमेनिया कहते हैं, और ये इम्प्रूवेबल है. आप उसकी मदर को बता दें कि बाल कटवाने से अच्छा है उसे इम्प्रूव करा लें.
राइट सर. उन्होंने अभी मेडिसिन भी स्टार्ट करी है, साइकोथेरेपीज भी उन्होंने स्टार्ट करी है, मेडिसिन भी स्टार्ट करी है.
गुड. आई होप शी विल इम्प्रूव.
राइट. यस. थैंक यू सो मच सर. थैंक यू.
इट्स ऑल माय प्लेजर मैम.
Sir, may I?
One question, please.
हाँ बताइए.
Sir, is it possible to identify depression at the onset? मतलब अभी the person is not going in that phase, in the depressive phase, but he is going towards depression. तो सर क्या possible है कि हम एकदम onset early stage पे ही identify कर लें और फिर उस हिसाब से कुछ ट्रीटमेंट या साइकोथेरेपी शुरू कर सकें?
मैम वी कॉल इट एडजस्टमेंट फॉर द फर्स्ट एपिसोड. अगर ड्यूरेशन क्राइटेरिया फुलफिल नहीं होता तो हम लोग एडजस्टमेंट डिसऑर्डर कहते हैं, और वी कैन ऑफर बोथ काउंसलिंग एडजस्ट फॉर द एडजस्टमेंट डिसऑर्डर, थेरेपी भी दे सकते हैं और मेडिसिन भी दे सकते हैं. एंड इफ इट हैज बीन रिकॉग्नाइज्ड इट इज वेल एंड गुड. मोस्टली ये सेकंड एपिसोड या थर्ड एपिसोड वालों को समझ में आने लग जाता है कि पिछली बार हुआ था, अब की बार भी शुरू हो गया, एंड दे कम अप अर्लियर सो दे कैन रिकॉग्नाइज इट. For the first time they are unable to recognize something is happening, I don't know what to do. Once a patient has passed one episode, one knows कि पिछली बार हुआ था, ये बहुत बुरी चीज है और ये कैसे improve हुई थी, how, where should I take help, and they seek help earlier too.
Okay, now I express my sincere gratefulness to Dr. Saxena for his wonderful lecture on depression. And really it was a marvelous time for all to hear in detail about the depression. Thank you, sir. Thank you very much.
It's all my pleasure,
for
sir.
your kind cooperation.
It's my pleasure, sir.
And now we are, thank you, sir. Thank you very much. And now we are switching to